Welcome to this explainer. Look, if you or someone you care for is dealing with joint discomfort, you already know the deal. A standard, everyday staircase, it can literally look like scaling Mount Everest. So today, we're jumping right in. We're bringing together some really essential insights from top medical experts to hand you a clear, actionable playbook on how to navigate stairs safely while managing that knee pain.
Here is our roadmap for today. We're going to cover stair safety and pain, the hinged knee brace, urgent care warning signs, and finally, caregiver fall prevention. Section 1, Stair Safety and Pain, the daily challenge for older adults. So, the crucial point here is that just being careful simply isn't enough. I mean, you can grip that handrail for dear life, but if a sudden, sharp spike in knee pain causes your leg to buckle, yeah, that handrail might not save you. Active, deliberate orthopedic pain management is actually a fundamental requirement for stair safety. They go hand in hand. Honestly, you just can't solve the safety issue without tackling the pain issue head on. Moving right along to Section 2, the hinged knee brace, Cleveland Clinic guidance. Now, according to the Cleveland Clinic, a hinged brace is way more than just one of those generic compression sleeves you might grab at the local pharmacy. It's a specific orthopedic management intervention meant for demanding activities, like tackling those stairs. Think of it kind of like an exoskeleton for your joint. The hinges provide this incredible structural mechanical support that basically mimics your knee's natural movement. This takes the brunt of the load, absorbing the pressure that would normally trigger that awful pain. For caregivers and older adults alike, grasping how the Cleveland Clinic specifically applies these braces is really your very first step toward daily pain management. Using a hinged knee brace for stairs, that's all about proactive intervention. It's about strapping that brace on before you even take that first step up. By doing that, you're stabilizing the joint, quieting down those pain signals, and ultimately making sure the actual physical mechanics of walking up or down are fully supported. And that brings us to a pretty critical contrast. On one hand, we've got manageable pain. You know, the kind of discomfort you can safely and effectively handle using tools like the hinged brace we just talked about. But on the other side, we cross a major threshold into urgent care territory. Knowing exactly where that boundary is between the pain you can manage at home and the pain that means you need immediate medical help is, quite literally, life-saving knowledge. Which brings us to Section 3, Urgent Care Warning Signs, Mayo Clinic Guidance. Look, we all get aches and pains, right? But the Mayo Clinic outlines some very specific warning signs that turn knee pain from a daily annoyance into a real urgent medical event. This is the exact moment where we stop relying on that trusty knee brace and start dialing the doctor. When these specific warning signs pop up, it means the structural integrity of the knee, or the tissue around it, might be acutely compromised, and that massively increases the risk of a catastrophic fall. We absolutely want to avoid that. So to put this into practice, caregivers really need to stay on their toes and memorize these essential protocols. First up, monitor daily knee pain levels. You've got to establish a baseline so you know exactly what normal looks like. Second, actively keep an eye out for those Mayo Clinic warning signs. We're talking about things like a sudden inability to bear weight, severe swelling, or maybe even a noticeable deformity in the joint itself. Third, and this is the big one, seek urgent care immediately when those signs appear. Seriously, do not wait around hoping it'll just get better on its own. Following this protocol is exactly how you stop a manageable joint issue from spiraling into a severe medical crisis. Section 4, Caregiver Fall Prevention, CDC Guidance. All right, this is where the Centers for Disease Control and Prevention steps into the picture. The CDC offers an incredibly authoritative framework designed specifically to help caregivers keep older adults safe from falls. Their approach is all about the big picture. We're talking about the home environment, medications, vision checks, and overall physical mobility. It's essentially the ultimate umbrella that all our other safety measures sit perfectly underneath. Now, let's synthesize these three amazing sources into one actionable, super easy to follow safety procedure for your home. Think about how seamlessly these steps flow together. Step 1 is your active mechanical intervention, managing the pain using the Cleveland Clinic's hinged brace advice. Step 2, that's your medical vigilance, keeping an eagle eye out for the Mayo Clinic's urgent warning signs. And Step 3 is your environmental and systemic safety, rolling out the broader CDC fall prevention guidance. By layering the orthopedic management of the Cleveland Clinic, the acute medical vigilance of the Mayo Clinic, and those holistic prevention strategies from the CDC,
caregivers can build a truly complete safety net. You see, none of these elements works perfectly in a vacuum. I mean, a brace isn't going to fix an acute injury that needs a doctor, right? And watching for warning signs won't magically stop a fall if the staircase is covered in clutter. You really need all three of these expert perspectives working together in perfect harmony. As we wrap up this explainer, I want to leave you with something to really chew on. Are you and your caregivers taking the right steps to prevent the next fall? Just take a second to think about your own home environment or the environment of someone you love. Are you utilizing the right orthopedic support? Are you actively watching for those critical medical warning signs? Take this guidance, bake it right into your daily routine, and really empower yourself with this knowledge. Thank you so much for joining me on this deep dive, and as always, keep learning.